Thyroid function tests include serum TSH, serum T3-T4, and free T3-T4. For serum TSH testing, there are 3 generations. The first and second generation tests have relatively high detection limits. Therefore, they can lead to false negative tests and fail to distinguish dysfunction from normal. Third generation assays are the most popular and can distinguish even mild cases of thyroid dysfunction from euthyroid patients. Serum T3 and T4 measure both bound and free thyroid hormone. They can be measured by a radioimmunoassay. Because drugs, illness, or pregnancy can change the concentrations of thyroid binding proteins, sometimes the free T3-T4 are preferred. The most common test is the direct free T4. The 3 major clinical uses of thyroid function tests are to screen for thyroid dysfunction, to monitor efficacy of levothyroxine therapy, and to measure the response to hypothyroidism treatment. Some experts suggest getting both serum TSH and free T4 because TSH can be normal in secondary or central hypothyroidism, or TSH-mediated hyperthyroidism. However, because this approach is expensive, most labs use a strategy where if initial serum TSH is normal, no further testing is indicated. To screen for thyroid dysfunction, second and third generation serum TSH assays are recommended because they are both more sensitive and specific than serum-free T4.
It is important to be familiar with the various pre-analytical factors that can compromise thyroid laboratory testing. Altered thyroid hormone and TSH levels occur in early childhood, old age, and in pregnancy, which may lead to misinterpretation when compared with adult reference range values. Medications can lead to confounding thyroid function test results by interfering with metabolism of thyroid hormone production and release. Common examples are lithium, glucocorticoids, and furosemide. Heparin may also cause spurious free T4 levels. Non-thyroidal illness can also lead to confounding thyroid function test results. Common examples are sepsis, MI, surgery, and malignancy. It is preferable to defer testing until the acute illness has resolved, unless there is a strong index of clinical suspicion.
For patients with health insurance, out-of-pocket costs for a thyroid test typically consist of a copay between $0 and $30. Thyroid tests are usually covered by health insurance when medically necessary. For patients without health insurance, thyroid tests can cost between $35 and $500 or more, depending on the type of test and where the test is performed. A TSH test performed by Affordable Lab in Michigan costs $39, while Accessa Lab, which has locations across the country, charges $60, and Health Testing Centers, also with locations across the United States, charges $79. Additionally, a T3 test at Affordable Lab costs $35, while Accessa Lab charges $70 and Health Testing Centers charges $99. Lastly, a T4 test will cost $45 with Affordable Lab, Accessa Labs charges $70, and Health Testing Centers charges $129.